Hello, good morning and good afternoon. It's a pleasure to be chairing the second webinar of the Node UK-Japan network. The Node Japan UK-Japan network is a joint partnership between the IRIS, the Institute for Research into Superdiversity at the University of Birmingham, and the Institute of Asian Migration at Waseda University in Japan. The network started through over a year ago, and we have published 6 working papers which map the number of different aspects of the issues related to migration and diversity in Japan and UK. You can find them online. I'm going to post them in the chat shortly. And also organized a large international conference in December 2019. Which we hope to have a follow-up in the future with other events. Today we have this second webinar contains our examination of the vulnerability, the migrants' vulnerabilities in the context of the COVID-19 pandemic. In the first webinar, we looked at the position of former temporary interns in Japan and undocumented migrants in UK, in particular with reference to access to healthcare and healthcare provisions. Well, today the focus is going to be on the position of refugees and victims of sexual and gender-based violence in UK, and the position of workers within the catering sectors in the Nepalese worker in catering sector in Japan. So without any further ado, I mean, to briefly introducing the 2 speakers today. The first, even they probably don't need much presentation. Our first speaker is Professor Jenny Phillimore, Professor of Migration and Superdiversity here at the University of Birmingham, founding director of IRIS, and also author of a forthcoming book with Routledge entitled Exploring Welfare Bricolage, looking at the way that migrants and ethnic communities in Europe handle issues related to access to healthcare and other aspects related to welfare. Our second speaker is Professor Gracia is director of the Institute of Asian Migration at Waseda University, and recently Gracia published a book entitled Immigrant Japan, Mobility and Belonging, which I really recommend. So our first each speaker going to speak for about 20 minutes, and then we collect the question in the chat. So please post them throughout the presentation, and in the end we're going to have a question and answer moment. So Jenny, do you want to start? I'll stop my sharing.
Okay, can you hear me and see my slides? That's a great start, thank you. Hi, good morning everybody. Really nice to be back at another Node event. Today I'm going to just give a short overview of a paper that is currently in R&R format in an article, journal called Violence Against Women. And basically it's looking at the situation of forced migrant survivors of sexual and gender-based violence under the early pandemic conditions. And we're looking at something that we've called accumulative violence. Now, this is based on a small project which had a kind of big impact at policy level and internationally, that was undertaken with Sandra Pertek, one of our PhD students, who played a really leading role in this project. And the paper has been co-authored with colleagues Janine Hurari, Saime Oshkarez, and Selina Kuz in Turkey. Right, so it became evident fairly early on in the COVID-19 pandemic that the effects and the impacts of both the pandemic conditions, that is lockdowns, etc., but also the disease itself was shaped by socioeconomic inequalities. So it became rapidly evident that there were some issues, and concerns were expressed at an early stage about what the impact might be on forced migrants in their various different situations in camps, in urban areas, in overcrowded accommodation. And we wanted to ask, knowing that many of the survivors of sexual and gender-based violence across the world are in very precarious situations, our first thoughts were, well, what is the effect of the COVID-19 pandemic on these individuals? And I'll talk through the methods in a moment, but what we've done for this paper is create a conceptual framework that draws together 3 types of violence. So we've used Lucy Maiblin's ideas around slow violence of the everyday, which is basically how the structural situation of forced migrants with being denied access to sufficient resources to pay for food, to pay for transport and so on, and how that trickles through people's lives on a, maybe lasting for years. So we took slow violence and this kind of very gentle, sometimes invisible, living with structural violence. We took Gracia et al.'s idea of the violence of uncertainty, and this is whereby migrants live in a continual state of uncertainty or liminality, not knowing what's going to happen in their future. Can they stay? Can they go? Can they access healthcare? Too many questions, not enough answers. With a third type of violence, which has been used by Davies et al. In relation to the Calais migrant camp, the idea of violent abandonment, that one form of structural violence is to do nothing, is to simply abandon people in the face of dreadful conditions, knowing that they are likely to encounter harm. Okay, so we took those 3 types of violence and applied that to our data set, and that's the structure that I'll use when I come to talking about our findings. Okay, so the methods. This was something I kind of conceived one sleepless night when I started thinking about, oh my goodness, what's happening to the respondents we spoke to. We'd already, as part of the Sarita project, so the Sarita project is a big international project collecting data across 6 different countries, looking at the situation of sexual and gender-based violence survivors. And we knew that they were in a very precarious position. We knew that their situation was very bad, and some of them were making tentative recovery by connecting with NGOs. So, a lot of concern about what's happening to these people. So we were able to access a small pot of resource for an emergency project, the Economic and Social Research Council, IAA funds. The project on the whole is part of the Europe and Global Challenges funds, and we've also received some philanthropic funding from Lansons in the UK to work with African respondents. What we did is we returned to interviewees in 5 of the countries, and we did this in a 2-week period, so it was really quite crazy. And the Sarita team all kind of came forward and did as many interviews as possible. Sandra coordinated the whole thing. It was pretty tough. And we used anything we could. This was early stage pandemic. Nobody had really kind of got used to doing research virtually. So we did all sorts of things. We did short telephone interviews. We did a lot of WhatsApp messaging and emails. So all kinds of forms of data. And we had one simple question: how has the COVID-19 emergency affected your life? And we saw verbal and online consent. We're lucky that we have a multilingual team. So we did interviews in Arabic, French, Turkish, Swedish, or English, depending on where we were interviewing, obviously. And our data analysis was basically a systematic thematic analysis of whatever we had. So we took those materials and we looked at the findings using an inductive approach. Okay, so what are the findings? Here we go. We had 52 interviews with survivors and 45 with service providers. It's worth saying that in Australia, they were a later stage in the project, and the only survivors we had contact with, many of them were still partnered with abusive partners, so it wasn't safe to interview them. I could talk for 20 minutes about safety and issues around that, but I haven't got time. So let's move on to the first kind of violence. What we found is that the slow violence intensified. So individuals reported a loss of informal support and employment. So some people were relying heavily on precarious work, agriculture, hospitality, and so on. And the informal support that came from NGOs was withdrawn quite rapidly because NGOs suddenly went online or stopped work altogether. There was no state welfare in place for irregular or migrants or people in Turkey with temporary protection. So any mechanism they had to support themselves just disappeared overnight. We had reports of an inability to afford food, to afford hygiene products, and everyday life basically just became much harder. So the slow violence that people lived with on an everyday basis before the pandemic, in which they lived in a state of extreme poverty, very hand-to-mouth existence, just became harder. And all the survival strategies that people had, which was kind of sharing food and accommodation with friends and this kind of thing, or swapping vouchers for cash, all of these strategies became impossible. We also found that the pandemic immobilized people, so it prevented movement to access key resources. So one of the things that asylum seekers and failed asylum seekers on low incomes do is that they cover large distances trying to identify the cheapest products in order to be able to survive, or they would travel long distances to work. All of this ceased. And we heard reports of enforced isolation. So the pandemic restrictions meant that people were unable to connect with others. That became illegal in some cases. And where people more widely went on to all these new apps that came up, like House Party, to connect with friends and family, individuals in our sample lacked data, they lacked Wi-Fi, and it was a real struggle. They couldn't share the burden. They couldn't talk through kind of how they were going to get through the everyday. So we heard reports of very difficult choices, increased risks, people saying to us, well, I have to choose between food, hygiene products, or data for my phone. So very, very difficult. And basically there was a kind of increase in invisible hunger and dehumanization. So intensified slow violence. We also heard reports of an increase in the violence of uncertainty. So bear in mind that many of the respondents in our sample are waiting for an asylum decision, they're waiting to be able to resubmit their case, or in the case of Turkey, they're waiting on resettlement programs. So they've applied to UNHCR and IOM, and they're waiting to hear if they're going to be resettled. Often, can they be resettled to a country where they can be reunited with family? So it's not just about safety, it's about family, it's about belonging as well. Resettlement programs were suspended, and in many cases still are 1 year later. So we have a quote from a woman in Tunisia here. She says, I feel as if I were inside a jail because of Corona, as if I was tied with a chain. I could no more recognize myself. I feel exhausted. I hate my life. We could no more think or work for our future. Everything was put on hold, and that includes asylum claims. So uncertainty, which was already open-ended, almost became a way of life. Finally, the violence of abandonment. No provision was put in place for SGB survivors. No provision was put in place for people in abusive relationships. Hostels for those escaping violence were closed. There were no escape routes. Mobility is a really important part of escaping abuse. Mobility became impossible. So we had people who were literally just staying in abusive situations because they had no choice, and reports of increased exposure to trafficking because the protection for SGBV survivors just disappeared overnight. For many, the main route to support, the main way that they could hold their lives together, having had multiple traumatic experiences, was to access support mechanisms through NGOs. This could be counselling, one-to-one counselling, but one of the things that comes out of the Sarita project as being really important is peer group support. And all of these mechanisms closed, didn't even go online, nothing. So you went from having some support that gets you through your daily life to having nothing at all. No attention was paid to the everyday needs of survivors and asylum seekers and people with temporary protection generally. So those individuals living in hostels, living in shared housing, they weren't given hygiene products. There were no measures put in place to enable social distancing. We heard some women telling us that they themselves were cleaning the hostel to try and reduce the likelihood of infection. And in the UK, the press reported the reality that there were very, very high levels of COVID infection in some of the asylum hostels. And what happened in the UK is the asylum dispersal system was ceased. So people were no longer sent to housing, they were kept in hotels. And to this day, there are over 40 hotels in London that are housing asylum seekers. This is short-term accommodation, which has become long-term accommodation. And as I say, without any provision, no access to healthcare, no social distancing. So for some children in the UK, schools put in place, and in Australia, and Sweden, schools put in place virtual education, and this education required access to both hardware, software, and data. And migrant children, children of survivors, unfortunately, were left outside of this education. I strongly suspect that this is still the case. So there was no provision for them to be able to even access Wi-Fi and no access to trauma services. And as far as we're aware, the majority of NGOs are still offering services online. And another project that we are doing on looking at vulnerable migrants who access the Doctors of the World clinic in London, they've moved online, and the numbers of people accessing their services has reduced by more than a third. And what we find is there's been a shift in the people who access their services, so that more people accessing the services who've got very bad health. So it's only the desperate who are able to get through. Okay, so what are the implications of all of this for SGBV survivors? Well, increased risk of SGBV. So we have enhanced dependency on abusers, basically, and on perpetrators without options for escape. We have more pressure, more attempts of traffickers to reconnect with those who were trafficked. We see people in Tunisia and Turkey being forced into prostitution, increase in child marriage, and an increase in honour-based violence reported in Sweden. I think the biggest finding here was the intensified nature of psychological trauma. So combine the three violences and you find that because of past violence, people's current situation, their psychological situation deteriorated. And we have a woman here who is a sub-Saharan African. I haven't named the actual country to avoid identification, but she says, because of past violence, sometimes it makes me get these suicidal thoughts. I don't know how to explain it. You know, when you feel you're stuck, you start getting flashbacks, frustrated, start thinking too much. If you can't work, you can't access support, you can't reach your friends, you're stuck at home, what do? You reflect on the past. And for many people, the past was pretty traumatic. They were only just beginning to tiptoe in a small way forward. So basically, we heard a lot of stories about the end of hope, going backwards and not forwards. So in conclusion, what we are seeing here is a kind of continuation of what's called the continuum of violence. So this is a concept that feminist researchers have used in relation to peace study to show how after the end of conflict, the experience of violence continues because of traumatized community. We saw a continuum of violence that included interpersonal violence, but also an intensification of state violence, which, you know, was a culmination of the three types of violence. So we see intensified structural violences with kind of that are slow, they're destabilizing, and these connect directly with physical violence, which is exactly what Galtung talked about when introducing the concept of structural violence in 1969, that structural violence and physical violence are not unrelated, and that structural violence can ultimately generate physical violence. And the physical violence was traumatization, it was abuse, but it was also the basic everyday things like hunger. So our conclusion is that the pandemic restrictions further invisibilize the invisible, and that you have this intensification of violence, which to this day is still not addressed by policymakers in any of these countries. Now, we want to move forward with this research. We're not sure whether we're going to do a follow-up study 1 year later, because this was April, so this was 1 month really into the pandemic really kicking off. At that point, like everybody else, we hoped that this was a short thing, it'll be over in 3 months, like we were kind of promised by policymakers. But here we are, and the latest concern is that survivors won't get access to vaccines. And also, what is the effect of 1 year of living in some kind of isolation? So we're contemplating rerunning this project. It's time rather than anything else that's the issue, and that we're looking at other ways of analysing our data. So we might look at a necropolitical analysis, for example, and whether the hurt and the harms that are occasioned to survivors were tolerated. There was a kind of prioritization of support within the pandemic, and certainly in the UK, you see a lot of support for business, but once you get down to those who are invisible, there's nothing, and just this intensification of violence. So I'll stop there. Thank you very much. There's a whole load of materials online. You can just Google sexual and gender-based violence, forced migration, and COVID-19, and you'll find those, and they're in multiple languages as well.
Can you see, Nando? I can't hear. There's no sound. Wait. Somehow I can't hear anything right now.
Aren't we all muted? Can you hear me, Gracia?
Yes, I can hear you.
I think we're all muted. That's why you can't hear us. I'm going to mute again.
So Nando, should I just go ahead or go ahead? Okay. All right. Well, thank you, Jenny, for your presentation. I think I'll just jump ahead. Somehow everything became so quiet. I'm worried that somehow I've lost some connection or something. So can you all see the screen? And if I scroll, does it move? Okay. And I think today I'm going to talk a little bit about Nepalese restaurant workers in Japan and the structural vulnerability in the ethnic business. I think, as Jenny has mentioned, what COVID has brought out is basically the structural vulnerability of structural violence that has already been in place. So it really kind of put a spotlight on the kind of vulnerability our subjects have been experiencing. So actually, this study is ongoing. I'm doing this research with a Nepalese researcher, Dalima Tamang, who's also here today. We have just started, and we have just started processing information. So the project started from a mega Mada's WADA, I'm sorry, WADA's reports, Mega's reports on Indian restaurant workers was done, when the COVID started. And in Japan Times, she had a report, and also in Japan Focus, she wrote a paper talking about how in Indian restaurants, the overall sales were reduced. And the cooks, Indian cooks, made 50,000 to 150,000 yen before COVID, and now many getting like 20,000 yen a month, or 50% of the wage during COVID. So this actually got me pretty alarmed. So if during normal times they were making 50,000 to 150,000 yen a month, which meant their hourly wage, because these cooks worked at least 12 hours a day. At most, they can take a day off a week. And that will mean that cooks are making 160 yen to 480 yen an hour, which equivalent to 1.1 pound to 3.3 pounds. That's like an hour. And that's really, really low. The minimal hourly wage for Tokyo was over 1,000 in 2019. So that actually, triggered my interest to know more about the Nepali cooks. So the reason why I want to study Nepali cooks is because even though Indian cooks are very substantial, but Nepali cooks are have been the rapidly increasing cooks. This is a graph of the Chinese and Nepalese and Indian cooks, and actually there's no cook visa. There in Japan, there's this skilled labor visa, but for these for the skilled labor from these three countries, almost all of them are cooks. So Nepalese restaurant workers have been increasing very rapidly, you can see, and in some years, especially between 2014 and 2017, the new entrance of cooks from Nepal passed Chinese cooks, who have been the #1 cooks in Japan, the foreign cooks in Japan. And also Nepali migrants in Japan the population has increased rapidly, and now they have over 95,000 people, and you can see 13% of them have this so-called skilled labor visa, which mostly mean cooks. And also very interesting is this dependence visa, as I will explain later. Most of these dependents are the wives and children of the cooks. And they're very important presence for Nepali community. And actually they're not dependent. They're oftentimes the main financial resources of the family. So the questions right now are very empirical. I started from very empirical puzzles. So what are the general working conditions of Nepali restaurant workers, regardless of COVID? And how did such working conditions come about? So we started this project from last September, and we're still interviewing. And right now, by now, of course, I speak none of Nepalese, not even a word. So Dalima has been immensely helpful in collecting data, and we communicate about this project frequently. We have interviewed 15 restaurant owners, both de jure and de facto, as I will explain, and 15 cooks. So you can see only 2 restaurant owners came before 1990 as tourists. So now they are PRs, and the majority came after 2000. And some of the restaurant owners came as students or employees, but most came on skilled labor visas. So what's the general working conditions? I think it's not surprising. Later on, after I finished this, I actually reread Depeche Karal's paper, and I realized, okay, actually a lot of that he described in 2016 hasn't really changed. So basically very low wage, and this is from our empirical data, and very long work hours. And there are cooks who couldn't even take a day off, oftentimes just half a day off, but they usually have only 2 days off around New Year. And also, it's a kind of a kitchen that's do it yourself, everything, and a do it all kind of situation. There's no section division. A cook or chef is in charge of everything inside the kitchen, or sometimes outside the kitchen as well. And for a lot of the cooks, you know, who came on cook visas, and those real cooks, oftentimes it meant downward professional mobility. Some of them, because actually many cooks we interviewed had professional experiences in India, in Middle East, like Qatar or Saudi Arabia, worked in Korea, in China, Shanghai or Guangzhou, and also in Finland, in Europe. So many of them had cooking experiences, and Japan, for both in terms of cuisine and in terms of the actual work they have to do, oftentimes is a downward professional mobility. So how such working conditions came about? So in case you're impatient, my main points are migration industry basically facilitated labor migration from Nepal to Japan, and it fed to this expanding ethnic entrepreneurship and led to ethnicization of Nepalese Indian restaurants. And then they became a kind of the whole, this business, ethnic business, had a very insulated structure, and had a increased interdependency, structural dependency, and vulnerability. So that's a basic kind of argument. So this is the structure of Nepali restaurant workers in Japan. Type 1, type 2 are so-called owners. Type 1, de jure, and often they're also de facto owners of restaurants. Many of them were not cooks to begin with, but students, employees, or the cooks who came earlier. Type 2, the de facto owners, they oftentimes still held cook visas. They're not owner of the restaurant by law. Rather, they get they pay a fee, or they register the company above the type 1 register the restaurant, and then they actually run and own the restaurant. There are always this kind of middleman agents that help them to deal with a lot of kind of documents and procedures in Japan. Type 3 and type 4 are cooks, but type 3 are trained cooks. Actually, they're actual cooks on cook visas. And type 4, they are called paper cooks, but might become actual cooks depending on where they end up. And they are also on cook visas. This is the basic structure of the restaurant workers in Japan. And so why are they insulated? Now, first of all, language and institutional. So basically, most of the cooks came as adults, and they couldn't speak a word of Japanese, and they were put in a restaurant to work 12 hours a day and 6-7 days a week. They had no exposure to outside world, and they couldn't learn the language, and didn't have the opportunity, or didn't have the exposure to learn the language. And also some type 1, type 2 people also had a language difficulties, and they rely on middlemen agents to deal with, and all that actually costs a lot of money. So they're insulated by language, and the other insulation came from institutional. There's a Japanese skilled labor visa. Once they came as Nepali Indian cooks, it's usually Indian cuisine, they have to cook Indian. So they cannot change the nature of their jobs. They have to work in Indian restaurants or Nepalo-Indian restaurants. So that really constrains the kind of possibility of engagement in Japan's labor market. And also, it's kind of there's increase of number of people within this community, made it the self-contained ethnic community. So there are a lot of things, as the Corral has pointed out, could be handled within the community, because they have some students, some former students, and some other people who had a bit kind of language ability, could deal with everything. So within it, people could rely on the ethnic resources. And according to Tanaka sensei, very little outside resources or intervention into this community. The NPOs are also oftentimes worked within. And there's this upward dependency. So basically type 2 rely on type 1 for their not only the renewal of visas and everything related to business, because the business is officially owned by type 1. And type 3 and type 4, they very much depend on type 2 and type 1, not only for their visas, but also for their livelihood. And in fact, within the community, people call each other in the kinship terms, like brothers and dai or whatever. But in fact, the relationship is very exploitative. The co-ethnic exploitation is not a news, but from this particular empirical case, we see very egregious exploitation by co-ethnics. Now, for example, Japan gives out some COVID relief loans and to restaurant owners, but a lot of type 2 owners do not get that loan because their restaurants were supposed legally owned by type 1. The type 1 will get money and type 2 run the restaurant, but cannot get, even though the restaurant suffered during the COVID, some of them do not get a loan or the Japanese subsidies because they don't have a legal ownership. And some in egregious situations, some of the type cooks did not necessarily get, not only being to put it that way, when the situations are good, their pay does not necessarily increase, but when the situation is bad, they kind of shoulder the burden. Okay, and why this sort of structure came into being, because, just one thing. Type 3 and type 4 also depend on type 1, type 2 for bringing in dependents, which actually will become main wage earners in some of the households. So migration, this sort of structural insulation and this sort of structural vulnerability was largely caused by the kind of labor supply driven ethnic business. And this labor supply driven tendency was created by this really vibrant, prevalent migration industry. And you can see, I actually draft this migration industry. Nepal has been a remittance-dependent economy. And also, because of that, there's a very strong culture of migration. It's Bidesh, very attractive kind of cultural notion. And there's also very vibrant migration industry there. So they have been sending a lot of workers and students outside. And Japan became one, as I think Carol talked about, how the social network played a role in channeling a lot of migrants from Nepal. But when they came to Japan, sometimes because of the heavy burden of migration costs, many of them could not really advance to primary labor market or gain professional mobility. So in the end, when there's a blocked mobility, they see restaurant business as the kind of something they can turn to as a kind of a resource, a kind of ethnic resource that they can use. So more and more people just rely on, and they can't, cooks or not, they became, restaurant workers and entered the restaurant business. And so there's in kind of almost imploding kind of the very intense competition within the restaurant business. Restaurant structure. And so what it caused is the ethnicization of Nepalese Indian restaurants. And so because so many Nepalese start owning restaurants and they could get cheap labor to do this, and they squeezed out the Japanese owners and some older Indian restaurant owners. And then more and more Nepali owned restaurants opened. And there is this tendency of racing to the bottom. So basically, there is a downward mobility of Nepalese Indian restaurants. Now, everybody serve butter chicken curry and all you can eat naan and rice. And in some places where there's a heavy competition, you can pay 500 yen, £3 to eat all you can eat naan. And one cook was talking about, he said this is really, for him, he felt really embarrassed and ashamed because somebody will come into the restaurant and stuff themselves with 8 naan. And he says that each naan is 135 grams of flour. And they just stuff themselves with naan and eat one curry. So basically they became like downgraded, the whole restaurant business. And also there's downward mobility of cooks. This is a very telling. There's one cook who came in 2007. When he first came, he worked for a Japanese curry restaurant. He was paid nijuniman, it's like 220,000 yen, which is probably equivalent to 1,500 pounds. With the same owner in about 10 years. Because of a competition, his wage dropped to 140,000. So in 10 years, even though he has been cook, even more experienced cook, his wage dropped by 100,000 yen. The same restaurant, same owner. And then the owner decided to quit the restaurant because it's just, he was not interested in it anymore. And also cooks themselves felt that there's a loss of prestige about Indian cooks and Nepali cooks because there's mixing of paper cooks brought in by the migration industry. As I said, a lot of this type 1 business later on became a kind of migration industry itself, has been bringing in cooks. So what the business became, opening new restaurant, because in Japan, it costs only 5 million yen to register a business. They open a new restaurant and they charge a cook 1.4 million yen to come to Japan. And even though they cannot really house all those cooks, and the cooks' fees became their profits. So more and more cooks, whether trained or not, came to Japan. And this sort of ethnicization of Nepali Indian restaurants and the downward mobility really create kind of structural vulnerability. The type 3 and type 4 have diminished opportunity to progress, because for Nepalese, progress is a very important thing. You become owner somehow, but given the situation, there's less likelihood for people on the bottom to be progress. And when the time becomes precarious, such as COVID-19, and people on the bottom became even more vulnerable. And this sort of structure, insulated structure, meant actually that most of people on the bottom were sharing, were shouldering the kind of burden. So the discussion is, I'm still thinking about it, try to do more literature review. And I think this may be something we can think of as a particular kind of tendency of ethnic business, kind of agglomeration, or the concentration of ethnic business in small niche. So basically, what Nepali restaurants have shown is kind of labor supply driven ethnic business, and it also became kind of semi-migration industry. And also there's this kind of very rigid a visa regime that conditioned them to stay in this very small kind of ethnic business. So creates this insulation, and also within the structure is hierarchical and exploitive. And for a lot of migrants, they don't feel that they are being exploited, and everything becomes normalized. They know they will get paid half of what the contract says, then they think it's completely okay. And I talked to my Nepali researchers, and even she, after being in the Nepali community, normalized that situation. And so this sort of normalization made kind of vulnerability and exploitation less painful, and also less likely to be exposed. And also, what I see is a kind of a transnational precarity as well. I remember when Depeche was talking about the Nepali cooks in Japan and bringing their dependents. I think in the conclusion, he was talking about how it's very likely more and more people are settling in. In fact, in my neighborhood, there's Nepali restaurants, and a lot of restaurant owners are bringing their children in. But what I see is, and then the majority of this Nepali cooks and even restaurant owners, the de facto restaurant owners, are not considering staying in Japan because, first of all, being paid half of what the paper contract says, they cannot afford paying into social securities. So basically, according to their contract, they're paid 220,000 yen. So they're asked to pay the equivalent amount of social securities and the pension and the health insurance into the, to contribute that, but none of them could afford that. So most of the restaurant cooks don't have any this sort of pension, social securities, or health insurance in Japan. And so they completely see their life in Japan as a temporary time to accumulate enough capital to buy land, to buy house in Nepal. And also, I think a lot of this sort of Bidesz money coming into Nepal, according to Zunam, has disrupted a lot of rural economy as well, and actually aggravated rural inequality and even lay a lot of land uncultivated. So that actually means it's a perpetuation of this sort of longing to go abroad and the perpetuation of this culture of migration. So I don't see that somehow this scenario is completing and contributing to the development anytime soon. So this is something I'm just thinking, and I'm looking forward to hearing your comments. Thank you very much.
Thank you, Gracia, very much for your presentation. Thank you, Jenny. Now we got about 10 minutes for questions. Just before starting, I have a couple of points I would like to make, and maybe as an opening for our speakers. I think both of you, I mean, what you bring together in this presentation is this idea that some of the vulnerabilities that the groups that you work with are produced by the migration regimes and the migration infrastructures. You know, this is in a sense. And I was wondering to what extent, from an institutional perspective, there is an acknowledgement of this sort of migration system produced vulnerability, and if there is any idea of tackling. I mean, Gracia obviously was talking about, you know, the visa hierarchies and restriction. So the question would be sort of around this acknowledgement, or even if you see any possibility or reflection around changing some of these structures from the perspective of the institution. For Jenny, I know that obviously Serida is a project which involves many countries. So I was wondering, again, reflecting on the migration regimes in these different places, to what extent this also, from your research, shows how the victim and survivors of sexual gender-based violence cope differently with the condition of COVID as a result of different migration regimes in the countries where you work. Okay, thank you.
Okay, which one do you want us to answer first?
Well, yeah, just two of you. I mean, it's quite easy. Jenny first and then Gracia, so we go back to the order of the presentation.
All right. I mean, the question about are they aware of the impacts of kind of the migration regimes? I mean, I can answer that more from the perspective of Australia, the UK, and Sweden, and say in many cases this is, you know, an intentional, it's the use of structure to enact violence in the hope that it will drive people away, either the people who are already there and who are undocumented or asylum seekers going through the process, or to put up a big sign that says you're not welcome here, don't come. So, you know, in the UK there's discussion about the hostile environment, but in Sweden, there are many hostile policies, and Australia's got its policy of actually putting people offshore and housing people in kind of warehouses whilst they await for, their claims to be processed. So it's almost like it's intentional. Now, within that framework, do they know what's happening with sexual and gender-based violence survivors? They could work it out. Do they care? Probably not. because the overall picture is, this is a political act, and these people are pawns in this procedure. I mean, I'm meeting with policymakers actually at the beginning of May in the UK to raise some of these issues, and to talk about how the need for gender sensitivity and so on. And they are interested in hearing about it, but it surprises me that this isn't something you could easily work out was going on. And yeah, the question about the different countries, interestingly, I was kind of thinking about that while Gracia was talking, and the commonalities actually overwhelm the differences. For sexual and gender-based violence survivors, I suppose the biggest things that make a difference is what's your immigration status, kind of which chimes with some of Gracia's work. What were the pandemic measures like? So it's a big difference between Sweden, where there was no lockdown, and the other countries where there was a lockdown. But other than that, there are very stark commonalities: isolation, loss of likelihood, poor housing, suspension of hope, and no provision of services. So I would say the commonalities are bigger than the differences.
Thank you very much. Gracia.
Yeah, I think you're right. That's a really kind of migration system. So what exactly, sorry, could you rephrase?
We're thinking about to what extent there has been any push for a change to the visa, for example, so the rules and regulation to sort of acknowledging these vulnerabilities linked to COVID, and the making it more easy.
I don't think this is something that the Japanese government is considering, and also I think one issue of this particular kind of ethnic business is that because people are insulated within, and also there isn't sufficient kind of civil society to help them, and I mentioned there's a normalization of this sort of practices. So nobody is actually problematizing this sort of practice that much. And in fact, a lot of immigrants we interviewed were very happy that to receive Japanese governments like 100,000 yen, because this is the first time, it's a free money that everybody, even foreigner, can get it. They feel like this, and this at the same time, this is the first time they receive any resources from outside of their ethnic community. So I think this sort of insulation is a very big issue, and also for Japanese government, everything on paper is fine, right? Because it says like you're employed for 220,000 yen, and even though in reality get half of that, but everything that was a cash service. It's all kind of cash in hand kind of business, and I think that's typical of ethnic business. So that actually is very difficult to regulate. What I see as a possibility of intervention is that I think the labor law should be applied, right? To what degree, we can empower the people to enforce that kind of labor law, which I don't really know. And the ethnic business literature sometimes overly portrays this sort of positive aspect of ethnic business for entrepreneurs, and is really kind of ignores the exploitation, really egregious exploitation of people within. So yeah.
Yeah, as usual, the questions are coming now, and we only have 4 minutes, so I'll summarize very briefly. There is a question for Jenny around what would you recommend to policymakers and social work in order to improve the situation of these the survivor of sexual gender-based violence. For Gracia, there is a question around to say something more about the paper cooks, to explain if the position of the Nepalese workers in Japan reflect the hierarchies also in Nepal in terms within the sector, or is something that comes from produced by the Japan sort of regime, and also the extent to which to what extent the position of Nepalese workers in Japan is different from that of the Indian workers. So I'm afraid you got 3 minutes in two to answer this full question. Jenny first.
Okay. For some groups, the amount of welfare that they received increased under COVID conditions, but not for the groups I'm talking about. It's not difficult to conceive that people need increased support. So they need financial support, they need access to data. That's really, really important. NGOs needed increased support financially to be able to get services out to people and to be able to do some limited one-to-one work. Suspending deportation, taking the fear out of things. And I came to the university this week for the first time in over a year. Social distancing measures, stickers, sanitizers everywhere. Why can't, we can do it in hospitals, doctors' surgeries, supermarkets. Why can't we do it in asylum seeker hostels? It's not so difficult. We're doing it everywhere else. I'm being very quick. So.
Thank you very much. Gracia.
Okay, very quickly, paper cooks, that's Shanshan's question. Yes, they come as cooks, and some of them do actually do something else, but they need the ethnic restaurants to renew their visas. If not, then they have to become undocumented workers. But some of them actually start applying for asylum in 2017. And so there are different kinds of ways to deal with it. It is quite easy to bring in cooks because it's a skilled labor visa. And as long as you qualify on paper, you have a 10 years cooking experiences, and you have this employer, because Japan's labor migration is employer dependent, then you can come in. That's why, a lot of employers can actually open new restaurants to bring in new paper cooks. And about Glenda, I think great question about the hierarchy of inside the ethnic community, because Dalima and I were thinking how this kind of caste and ethnic kind of situations are also affect inside the communities. Right now, the findings are inconsistent because, for example, Taman is a marginalized group. They had fewer people, and some of them had harder situation. But in the end, it's a very fragmented places. Nepal is a very, very complex. And so right now, I don't see a kind of holistic picture how the sort of hierarchies translate directly, other than who came first and what kind of visas they hold, and what kind of kinships, and how much resource they have in possession. So that actually something we're examining. And also, and David's question about Nepali Indian restaurant owners, I haven't done. I think Mega knows so much better about an Indian restaurant workers. What I actually, because I did Chinese restaurant workers, what I can see is that they are different. Chinese restaurant workers, they could make as much as 400,000 yen a month if they work here for 8 years. So, and I think because Chinese restaurants in Japan is not considered ethnicized business, as much wider, market, and I think so this is something maybe we can do in the future, but definitely I think it's different from the Chinese cooks.
Thank you very much to our speakers. Unfortunately, it's 10 o'clock, so we have to close. And thanks for the questions. And for Sarida related question, you can look at the website of Sarida and following them on Twitter. Obviously, you can. I've saved the question. I'm going to send them to Gracia in case, just so that she knows the kind of questions they received. We look forward to see you at our following next events. We're going to get in touch through the emails and let you know when we're going to have the next dates in our diary. Nando UK Japan is funded by the Economic and Social Research Council in UK and the Japan Foundation. Thank you again, and well, have a good day. Bye.